Bismillahirrahmanirrahim. Assalamu alaikum. Our today's topic is Obsessive Compulsive Disorder. So, you might have used this term or have heard this term in your daily routine life that she is an OCD girl, she has Obsessive Compulsive Disorder, or she has obsessions and compulsions. But what do we say in our normal life? That does not necessarily mean that the person about whom we say is a person who is suffering from obsessive compulsive disorder. They may have obsessive compulsive personality traits, but disorder is different from this one. So, obsessive compulsive disorder, or more commonly it is known as OCD, is a disorder in which people have recurring unwanted thoughts, ideas or sensations, which are obsessions, that make them feel driven to do something repetitively, which are compulsions. So, here the individual has thoughts related to any object, related to any person or any situation, which are coming to the mind of that individual repeatedly. Recurring thoughts is repeated thoughts. These are the thoughts that are coming to individual's mind repeatedly, and these are unwanted thoughts. Individual does not want to bring these into his mind, but he is forced to think about such events in life. And these thoughts make them feel driven to do something repeatedly, which are compulsions. And because of these thoughts, individuals, they are compelled to perform certain actions, and those actions are known as compulsions. So, obsessions are thoughts and compulsions are actions. Obsessions are thoughts which are very repeatedly coming to the mind, and unwanted thoughts. And actions are again repeated actions, repetitive behaviors, and again those actions, they cause anxiety in the individual. Those are unwanted actions. Now, many people have focused thoughts or repeated behaviors, but these do not disrupt their daily life. As in the beginning, as I told you, that usually we use this word in our daily life, but about whom we use this word is that person may not be suffering from the disorder, because there are so many times that focused thoughts, they come to the mind of the person who is very much concerned about the task or the job to be done. So that is why they may have those structured and focused thoughts coming in the mind again and again. But the person who is suffering from OCD has the thoughts which are recurrent and which are unwanted, and they do not give him any benefit in life. Those thoughts are just causing anxiety in the individual. For people with OCD, thoughts are persistent and unwanted routines, and behaviors are rigid, and not doing them causes great distress. So these thoughts are unwanted and persistent, keep on coming again and again. And the actions are again compulsive actions, because if the individual is unable to do that, then it will cause great distress. So in order to avoid that distress or anxiety, individual performs that action. Now, separately studying what are obsessions. That obsessions are recurrent, persistent thoughts that hinders one's performance. These dominate the mind unimpeded and remain out of individual's control. So, these thoughts, they come to the mind of an individual unimpededly, means that without any gap, without any break, they come to the mind of an individual, and it becomes difficult for the individual to control these thoughts. So these are the recurrent and persistent thoughts, and in this way they disturb the performance of an individual. Whereas compulsions are repetitive actions that a person feels compelled to perform. If the individual does not perform such actions, he experiences intense anxiety and worry. The carrying out of these actions alleviates anxiety. So when out of those obsessions, when the individual, in order to avoid obsessions, performs the tasks which are compulsions, and after performing those tasks or compulsive actions, individual feels relieved from the anxiety. So the carrying out of these actions alleviates anxiety. Fine, it relieves the individual from anxiety, tension and worry. So in our daily life, the compulsions and obsessions of minor nature are usually found in every person. So we may have this thought coming to our mind when we leave our home, that whether we have locked the door or not, or whether we turned the stove off or not. But the obsessions of the mental patients, they make their life miserable, because individual spent hours in thinking about those topics, keeps on pondering, worrying, thinking about those issues, and which basically disrupts the life of the individual. Similarly, compulsions, we also have this normal individuals, they may have this tendency of performing compulsions in their daily life. But with the OCD patient, those compulsions are unwanted actions, and again the individual performs those actions 10 to 15 times in an hour. So an ordinary person does not perform, for example, when he thinks that his hands are getting dirty, so he is not going to wash the hands 15 times in an hour. Only 1 or 2 times he is going to wash the hands, and that will be sufficient. But OCD patients, they do not get satisfied by this, and they repeatedly do that particular task. Now this is the cycle, which is a vicious cycle of OCD, very dangerous cycle of OCD, that obsessive thoughts come to the mind of the individual. Those thoughts cause anxiety. Now in order to relieve the anxiety, individual performs compulsive behavior, and when those behaviors are performed, then there is temporary relief. Now this will be about one object or event. Then again the obsessive thoughts will come related to some other object or event, and the same cycle will keep on going and going. Now the symptoms of obsessions: fear of germ or contamination, unwanted, forbidden or taboo thoughts. Individual thinks about those issues which are not easily discussed in our daily life. Taboo is a word which is usually not considered good in our society, which is not the norm or the value of the society. So individual has the thoughts, who is suffering from obsessions related to sexual impulses, aggressive thoughts towards self or others, having things symmetrical and in perfect order. So when an individual wants everything in a neat and clean manner, in the perfect order, that there should not be any disturbance in the order, then it is obsession. Symptoms of compulsions include paying too much attention to cleanliness, ignoring specific things such as staying away from black or brown things, repeatedly rechecking what you have already done, doing specific things very slowly. So when individual doubts, because these individuals who suffer from OCD, they become suspicious as well. So when they doubt that the things which are of black and brown color, they are not good for them, then they will always stay away from them. They will repeatedly recheck what they have already done. They will repeatedly recheck the door lock, the gas stove, the light is on or off. And they may do or perform certain things very slowly, like bathing or eating in a very slow way. And they give too much attention to cleanliness, to order and symmetry of the things in their home and office. Now what happens when the individual who is suffering a lot from this disorder? So what consequences he or she faces? The very first is that sense of insecurity and guilt is developed. So when they repeat the task again and again, they perform a task, then this develops a sense of insecurity in them. They suffer from perfectionism. Perfectionism is you can say a trait of a personality where the individual wants everything to be done in a very perfect manner. Whether it is the office work or some other responsibility, but that should be done in a very perfect manner without any single error and with very symmetrical way, in a neat and clean manner. So when individual they suffer from perfectionism, then they keep on redoing the task. One time they have done, then they find mistakes, then they remove it, then they do it for the second time, and they keep on doing that until they get satisfied, and they never get satisfied. Individual is unable to get relaxed and take rest. Definitely at the moment of rest, when these unobtrusive thoughts, they keep on coming to the mind of the individuals, and due to those thoughts they perform the rituals, those actions which are compulsions, then they cannot get relaxed. They are also suffering from suspicion. They doubt others. They doubt whether they have done this thing or not. So even the life partners, they doubt the loyalty of one another. They become accustomed to procrastination. Procrastination is the time delay, deliberate time delay. When people they deliberately delay the task without any specific reason, they keep on delaying the task. And mostly those who are perfectionist, they also procrastinate because of perfectionism, they do not get satisfied, and in this way they do not meet the deadlines and they delay the task. Their interrelationships gets disturbed. Their relationship with their family members, their relationship with their other relatives, they all get disturbed. Now, what causes OCD, Obsessive Compulsive Disorder? There are different viewpoints related to OCD. The very first is the psychoanalytical theory, which says that individual fears that his sexual or aggressive wishes may get out of control. And they also say that such people, they have had very strict toilet training. Hence, the individual is fixated at that stage. If you remember the developmental stages given by Sigmund Freud, oral, anal, phallic, latency, and genital stage. So during the anal stage, when the child gets toilet training, and if the parents were very strict regarding cleanliness, then they also develop this disorder. So they suppress their feelings concerning sin, and when they fail to do so, they suffer from OCD. Then there is viewpoint by another person, Alfred Adler. According to him, that when it may be caused by the fear of lagging behind in a competition and being ineligible. When the individual is unable to compete someone else, and in this way suffers from the feelings or thoughts of ineligibility, and which may further lead to the feelings of inferiority complex. If parents, they are discouraging, they do not encourage, they are discouraging, then they may unconsciously engage in performing certain tasks and having certain thoughts. Behavioral cognitive theory says that obsessions and compulsions are instances of learned behavior. The alleviation of fear serves as a reinforcement for that fear and for that behavior. For example, the individual washes his hands time and again in fear of germs, and the washing of hands alleviates his fear of germs, and he feels relieved. So according to them, it is in our past experience that when we perform these rituals, after having these thoughts, when we perform these rituals, mean that after having obsessions, when we perform compulsions, then we get relieved from the anxiety. So performing of those actions basically relieves us from the tension of those thoughts, which we have learned. So we have learned that when we will do this thing, we will not get suffer from the anxiety. So in this way, they keep on doing that particular thing again and again, mainly to avoid the anxiety associated with it. Now, what can be the treatment of this disorder? Completely curable treatment is very rare in this case. Mostly people, they can be taught to manage their symptoms, but complete cure is very difficult. Now, the most common treatment approaches may include behavioral therapy, cognitive therapy, medication. Behavioral therapy tries to decondition whatever the individual has learned in the past. It tries to decondition the association between that action and the relief in the anxiety. Cognitive therapy basically tries to address the negative thoughts or obsessions that come into the mind of the individual, and later on which basically cause the compulsions. So they address the negative thoughts of an individual who are suffering from this disorder. And then medication can also be useful. So this was all about the OCD or Obsessive Compulsive Disorder. Our next lecture will be post-traumatic stress disorder and acute stress disorder. Till then, Allah Hafiz.